Many patients' neck disorders are exacerbated by or triggered by lots of sustained neck joint flexion. Joint flexion of the neck is when the neck is looking down. And I also subscribe to the hypothesis that many, if not most, of these disorders originate because there's such an imbalance of forces on the neck joints in our daily lives, meaning most people are spending a lot of time looking down in a flexed posture and very rarely look all the way back into a full extended posture of the neck. So that imbalance kind of dominates. What I want to say today is that yes, we think of neck flexion in sitting, looking down at laptops, looking down at books, looking down when you're cooking, looking down when you're cleaning, and looking down of course, at cell phones a lot of the day. But people also forget that we can go into neck flexion when we're seated or reclining in bed. So don't think of neck flexion only in sitting upright, but also remember that if you're in bed at night and you're lying against the headboard and your head is looking down at your laptop, your book, or of course your phone, you're also in a neck posture of flexion at that point. And sometimes that's even more sustained because you're in that position for half an hour, 45 minutes or more, whereas sometimes in sitting you may be looking down at your cell phone, but you look up for a brief moment. So that can be more of a sustained force into flexion, which can be more aggravating for some people. So if flexion is triggering, or if we think flexion is creating or exacerbating the disorder in the joints of a person's neck and creating their symptoms, we need to be mindful of how much flexion they're getting in sitting and how much flexion they're getting reclining in a bed at night.